Sanitary pads. During puberty, girls will experience menstruation, which may cause some confusion when choosing sanitary products. Key points. 1. Sanitary pads come in different sizes for each stage of the menstrual cycle. 2. Tampons are cylindrical, single-use sanitary products made from cotton, rayon, or a blend of both. 3. Sanitary pads or tampons should be changed every 4 to 6 hours to prevent the risk of toxic shock syndrome, TSS. The decision to use sanitary pads or tampons depends on personal preference. What are sanitary pads? Sanitary pads are rectangular absorbent materials that are attached to the inside of underwear. Some have adhesive wings that fold over the sides of the underwear to provide better security and prevent leaks. Sanitary pads come in different sizes to suit various stages of the menstrual cycle. Some pads also offer odor control, though they may cause vaginal irritation. How to use sanitary pads. To use a sanitary pad, peel off the adhesive strip and stick it to the bottom of your underwear. Change the pad every 3 to 4 hours. If the menstrual flow is heavy, pads may need to be changed more frequently. Regularly changing pads can also reduce odors. When disposing of a used pad, wrap it in toilet paper and throw it in the trash bin. Do not flush sanitary pads down the toilet, as they can cause blockages and create a mess. Sanitary pads come in different sizes for each stage of the menstrual cycle. What are tampons? Tampons are cylindrical sanitary products inserted into the vagina to absorb menstrual blood. They come with a string at the end for easy removal and monitoring during use. Tampons are typically made from compressed cotton, rayon, or a combination of both. They are single-use products and should be discarded after removal. How to use tampons. Tampons are relatively easy to use when following the instructions on the package. For first-time users, consider these tips. Wash your hands thoroughly and remain relaxed when inserting a tampon. Applicator tampons, especially those with rounded tips, can be easier to insert. Change tampons every 4 to 6 hours to avoid toxic shock syndrome. Symptoms of TSS include high fever, vomiting, diarrhea, severe muscle pain, weakness, dizziness, or a sunburn-like rash. If any of these symptoms occur, remove the tampon immediately and inform an adult. Seek medical attention at the nearest emergency department as soon as possible. To remove a tampon, gently pull the string and clean yourself with water or a wet wipe. Tampons also come in different sizes and absorbency levels, so it is recommended to start with the lowest absorbency. Tampons are cylindrical sanitary products. Can tampons get lost in the body? Many girls worry that tampons may get lost inside the body. Fortunately, this is impossible. The cervix, located at the top of the vagina, is too small for a tampon to pass through. It cannot move to other parts of the body. If you cannot find the string initially, try to relax. If necessary, seek assistance from a parent or guardian. Sometimes, girls may forget that they already have a tampon in place and insert another one. Even in such cases, tampons cannot get lost inside the body. Simply remove them as soon as possible. How should girls decide between tampons and sanitary pads? Choosing between tampons and sanitary pads depends on personal preference. Many girls start with sanitary pads when they first begin menstruating, but may switch to tampons for activities like sports or swimming. Tampons are also more discreet to carry in a purse or bag. Another advantage is that tampons are not noticeable once inserted. Conversely, sanitary pads may feel bulky to some girls. Other girls prefer sanitary pads because they are easier to use and serve as a visible reminder to change them regularly. Many girls alternate between tampons and pads based on their needs, activities, and flow levels. Some use pads at night and tampons during the day, while others with heavy flows may use both together for added protection.